Welcome to MedEd Bytes, micro just-in-time education. Hello, this is Karen again. Today's Byte will discuss suggestions to obtain a snug fit of the SonarMed sensor to the patient's endotracheal tube. The SonarMed airway monitoring system uses a sensor that attaches to the end of the endotracheal tube. Each sensor is sized for the appropriate size endotracheal tube. Example, a 2.5 sensor is for a 2.5mm ETT, and a 3.0 sensor is for a 3.0mm ETT. It is recommended to obtain a snug fit of the sensor to the endotracheal tube when setting up the system. Oftentimes, patients are in incubators with heat and humidity settings that can soften the plastic of the endotracheal tube. Inserting the sensor well into the endotracheal tube can help to minimize the effects of the plastic softening. How to help obtain a snug fit. The sensor has a standardized size nozzle that meets the specifications for the corresponding endotracheal tube. Since the nozzle is shaped like a funnel or wedge, the deeper the sensor is inserted, the snugger the fit. The greater the area of the endotracheal tube that covers the sensor nozzle, the better the fit. Use the same clinical judgment practice you do with the adapter of the endotracheal tube. It might be a good practice to verify that insertion of the sensor into the endotracheal tube is adequate as you do patient care. Some clinicians prefer to cut the end of their endotracheal tubes. In this case, use the same clinical practice of your institution to connect the sensor as you do for the regular endotracheal tube adapter. The angles of cut tubes can vary. Some tubes might be cut at a severe angle. The tip of the pencil illustrates that a very small portion of the endotracheal tube is fully covering the nozzle of the sensor. By cutting a less severe angle and further inserting the tube, the sensor would have a better fit. By taking a moment to observe the fit between the SonarMed sensor and the patient's endotracheal tube, especially before care, patient transport, or kangaroo care, the clinician can reduce challenges that might occur from a less secure connection. Medtronic, engineering the extraordinary.